Hello everyone, I am Pooja. Right now I am pursuing my Masters of Public Health from Goenka University, Gurgaon. So today we are going to discuss about what is IVF. So before getting into too much details about IVF, firstly you have to know about what is infertility. So infertility is not being able to get pregnant after trying for 1 to 2 years. And now let's discuss about what is IVF. So IVF is in vitro fertilization. There are two types of fertilization is there. In what is in vivo fertilization and second is in vitro fertilization. So in vivo fertilization, the fertilization takes place inside the organism's body, and in vitro fertilization is the fertilization process takes place outside the organism's body. Before going into too much detail, let's talk about what are the causes behind infertility and why we need IVF. So the couples having the blocked or the missed fallopian tubes, couples in which the male having very low sperm count or even absent sperm counts, or if you have endometriosis or the scar tissues that affect the tubes or the ovaries or other tubal problems. So all of these categories can now conceive through IVF. So what is the statistics of IVF? So one in four couples in developing countries are affected by infertility, and about 448.5 billion couples affected by infertility worldwide. Nearly 2% of live births in USA are a result of ART. So ARTs was what? Assisted reproductive technology. So what is the process of IVF? So IVF is the process of fertilization where an egg is combined with the sperm in vitro. In vitro is in the glass, in the tubes, or on the laboratory basis. This process involves monitoring, stimulating the woman's ovulation process and removing the ovum or the ova from female ovaries and letting them fertilize with the sperm in a cultural medium or in the laboratory. After the egg fertilized, or the fertilized egg is called zygote, undergoes the embryo culture for 2 to 6 days. It is transferred by the catheter into the uterus with the intention of stabilizing a successful pregnancy. So in July 1978, Louis Brown was the first child successfully born after her mother receiving IVF treatment. So the women who are past their reproductive years have the infertility partners having the idiopathic female fertility issues, or have reached the menopause can still become pregnant. So what is the method? So IVF method involve mainly the 6 stages. What are these 6 stages? First is suppressing your natural cycle. So we can suppress the natural cycle by using the medication. And second is helping your ovaries to produce extra eggs. And third is monitoring your progress and maturing the eggs. So for this monitoring, what is used? USG is carried out to check for the development of the eggs, and another is collecting the eggs. So a needle is inserted into the ovaries to remove the eggs. Fertilization, and the another is the fertilization of the eggs. So eggs are mixed with the sperms for a few days to allow them to be fertilized, and the last one is transferring the embryo. So one or two fertilized eggs of the embryos are placed inside the womb. Once the embryo has been transferred into your wombs, you will need to wait 2 weeks for before taking a pregnancy test to check that if the treatment has worked or not. So there are some investigations required before IVF processes starts. So what are the investigation? These are the blood test, scan, and the partner's semen testing is required for what treatment is to be given. So we call the patient on the second or third days if the in the cycle for proper investigating to know that what amount of medications are required or it is necessary for the proper successful of the IVF every day on definitive time. So time is very important factor in whole process of the IVF. So if we are giving medication to that patient, so time is very necessary. Like if the patient is taking the injection at 3 p.m, so the second day 3 p.m is a fixed time for drug administration. So there are some myths there. So let's clear some of the common myths regarding pregnancy and the fertility. So usually there is a female problem in 30% of cases and the male problems in another 30% cases, and the other cases are remaining unknown, or but the but male and the female factor both are equally responsible, so only the female is responsible is completely a myth. The fact is that both the couples are equally responsible for that. So some females having myth that if they had miscarriage in the last pregnancy, so there is an increased chance of having the another miscarriage. So in fact, the overall risk of a woman is for miscarriage is 20%, is not increasing if you having miscarriage earlier. Only 1% women face the recurrent miscarriage if she having two or more abortions back to back. So keep yourself calm, go to the consultation for the healthy pregnancy. And the one of the most common belief in the females is that if you having one ovary, then you ovulate once in 2 months. No, but the fact is that if one ovary is removed, then the remaining ovary will be compensate, uh, that is removed, and ovulate monthly. So keep calm and consult your doctor about your pregnancy process, and consult for your health.